So the SWOG 1211 study is the first enrichment design randomized clinical trial for newly diagnosed high-risk myeloma patients that I wrote when I did not have gray hair back in 2011, and we initiated this trial in 2012 as part of an NCI high priority initiative to focus on high-risk patients as we did not have any standard of care options for those patients. RVD was considered a standard of, a reasonable standard of care induction regimen at that time for these patients. And that was looked at as the standard of care arm. But after 8 cycles of induction, patients actually continued a dose attenuated maintenance with the 3 drugs. Whereas the experimental arm added elotuzumab as an adjunct along with RVD. So the comparison was RVD or RVD elotuzumab. And the schema was the same, induction followed by maintenance. Both transplant eligible and ineligible patients were included in this randomized phase 2 trial. And stem cell collection was allowed, but stem cell transplants were not, unless the patients were progressing or coming off of protocol due to disease relapse or progression. And the primary endpoint was PFS. Secondary endpoints were overall survival as well as overall response rate and safety. The high-risk definition included high-risk by gene expression profiling or primary plasma cell leukemia or FISH abnormalities for translocation 1416, 1420, deletion 17p or amplification of 1q21, and elevated serum LDH twice above the upper normal limit of the institutional limit. And patients had to be newly diagnosed, had to have one of these high-risk features. Of note, primary plasma cell leukemia patients had not been included in any randomized prospective clinical trials to date. So the trial did not meet its primary endpoint after a median follow-up of 53 months. However, the historic control assumed a PFS benefit for high-risk patients of about 26 months. And this is based off of the total therapy data. So these are historic data based on patients getting tandem transplants and PIs, NMIDs, and cytotoxic chemotherapy. And on the standard of care arm, the PFS was 34 months. On the experimental arm, it was 31 months. The median overall survival was not reached in the RVD arm, and it was 68 months on the RVD elotuzumab arm. No major differences between the overall response rate or safety, except for higher grade 3 and above infection rates in the ELO arm, as well as higher sensory and motor neuropathy in that arm as well. So overall, the trial is negative, but exceeded expectations for this kind of high-risk patient population. And it is the first prospective study that actually shows the PI-IMiD combination for continuous therapy actually benefits high-risk patients.